So the mission of San Ysidro Health is to improve the health and well-being of the communities we serve with access for all. And that really says a lot, because what it says is we do not turn anyone away in the 47 program sites where we operate throughout San Diego County. So we have 108,000 lives in our care, and we're able to offer many working families in underinvested areas medical, dental, and behavioral health services that are needed now more than ever.
For the most part, do serve a lot of the underserved populations. A lot of the need is more of your health maintenance or chronic disease management based on the health disparities in the communities we serve. They tend to have a higher rate of some of the chronic diseases such as diabetes and hypertension.
Started with a group of 7 founding mothers that organized because the only doctor in San Ysidro at the time was going to leave to go work in Chula Vista. So instead of giving up, they actually organized and founded a little clinic in a little white house that was volunteer driven. And who would have known 52 years later that we would be where we are today?
So it was no surprise to us when the pandemic hit that our population was hit the hardest. So we were seeing rates in our community 4 or 5 times higher than the rest of the county.
We, throughout COVID, have been extremely fortunate to receive so many generous donations to help us meet the need at hand. Many of our communities where we live and operate were experiencing COVID 4 to 5 times higher than the rest of the county. So we stepped in right away and provided not only COVID kits, where we were able to supply families with a thermometer, hand sanitizer, as well as other products to make sure their home was safe for the entire family. We were able to raise nearly $800,000 for our COVID relief fund, many of them from first-time donors, and we don't want to lose that momentum.
So it wasn't just one site where we treated COVID patients. There was a period of time where we became a monoclonal antibody regional center for COVID treatment, which is the outpatient treatment. We've always seen our role not as just providing services, but really advocating for our patients. And so we knew that we needed to provide the education, the outreach, the resources for our patients so they understood not only the disease, what they were facing, how to keep themselves safe, and then how to prepare for the vaccine. We played a big role, I think, in the vaccination efforts. And while early on, we were seeing our numbers of infections 4 to 5 times higher than the rest of the community. Now we're seeing our vaccination rates the highest in the community.
We were able to bring the entire region to a healthy level that allowed us to open up and start that recovery process. And that, to me, there's such a life lesson there. That's how interdependent we are. So what's good for San Ysidro Health really is good for the rest of the region for us to thrive.